Hi, I'm Joe Massad, and today I'd like to talk a little bit about one of the problems that I think we've had in dentistry since the very beginning, and that's what a patient's expectations are. It's extremely difficult to determine what they really want, especially if you're going to be doing a full, complete prosthesis, whether it be complete denture, whether it be fixed implant prosthesis, whether it be even, crown and bridge. We have a lot less opportunity when patients have teeth to make a lot of movements. When they, have loss of teeth, it's much easier to move teeth and change sizes. But patients, look at pictures, and yes, they may say this is what I want, but they want to see something in their mouth. So this is basically going to be a preview, and I'd like to announce what we're going to be doing today is introducing our tooth shells. Now, we're going to be naming this very soon, but this particular, as you can see here, this shell, they actually come in 8 and 12, and in other words, they're all connected together, so we'll have 12 teeth that are thermoplastic, and these can actually be bent and shaped around patients. For example, how about this patient here with natural dentition? Okay, well, look at all the spaces. We could actually take the tooth shell and we can say, well, let's just actually take this, and with a little white wax, we can actually, heat and mold, shape this, and actually show the patient, hey, this is what you're going to look like when I fill those spaces, you see. And you place this directly in the patient's mouth. You can make the teeth longer, shorter, because there are 4 modes, and there are 3 sizes for every mode. Now, you also have the ability to take the patient's existing denture, for example, okay, and shape it around their existing denture. So you say, well, how about if we took these teeth that are worn down, and what if I put this on? Let the patient choose the size. You can make it shorter, longer. You can adjust the midline position. It's so easy as opposed to just using wax. These are also can be utilized in the wax try-in, and as opposed to just using what? Well, suppose that just using wax, we actually set anterior teeth that the patient have selected from the first appointment. Now, let's get on how do we actually do this. From the very first appointment when we see a patient, we're going to let them do what? We're going to let them get involved in the selection of teeth, the shape, the shade. It should be their responsibility. And I know as dentists, we're artists of the mouth, but at the end of the day, the author of aesthetics is the patient. You and I are not necessarily going to be going home with our patients, so therefore it's necessary for them to be able to be the primary decision maker, or at least one of their family members. I think it gets us out of a lot of trouble, and I think it really is what needs to be done. Now, we're going to make our prosthesis the very best we can, make it functional. We're going to try to influence them on aesthetics to some extent, but at the end of the day, it's theirs. So the patient will now choose something. This lady has a complete maxillary denture, and she particularly picked one of the teeth, which is basically a shell, and they come in those, once again, 3 sizes and 4 modes. And I'm going to actually put it in hot water, generally between 175 and 180 degrees Fahrenheit. I'm going to now make it extremely soft. These shells will bend. They're going to be very rubbery. I'm going to now overlay it over the teeth, and once I've shaped it, I put a little white wax and then place these shells right over the white wax, which will adhere to the labial buccal portions of that tooth. So now this is the patient's existing denture the day she's in, and I'm now demonstrating something that we've never done before. Immediately, what are you going to look like? Well, pick something you like, or help them choose something. Now I've got these in position, and what you see, there they are, and I use a little larger tooth to hide a little bit of gum. I use a little wider tooth that looks very nice. Now we place it in the patient's mouth and ask them to look. Let them choose. If they don't like one, get another one. Okay, there we are. She was very satisfied with this. What an easy way of doing this. You can put this on the patient's existing denture, the existing dentition, because these shells are extremely thin and they're rubbery once you've actually heated them. So this is a thermoplastic material that has no memory. Now, what would you like? On a wax try-on for a full denture or an implant, would you want to use wax? I never get the midline correct. But if you use the shells, you can actually much easier see the midline, the height of the tooth, the size of the ledge of the tooth. So which one would you like? Well, I basically exclusively have been using these shells for the last few years, and now they're going to be available through Nobilium. I'd like to thank Nobilium. I'd like to thank you for watching today.